Hello?
Oh, hello, is that Chris Ferguson?
Speaking.
Hello, hi, Dr.
Two things, please. One of the things is, as you noticed, my mother was on a antibiotic for a chest infection. The thing is, some time ago at a previous home, she had a visit from the speech therapist. I'm concerned that with this, what I saw the other day at the home, and also a couple of weeks ago a nurse put down an appointment for a doctor which was cancelled, but the nurse was concerned within that day she had problems about eating and drinking.
Okay.
So the other incident I saw coming up to a week ago now was that my mother's mouth, when I went to visit her in her room, her mouth was full of food and she looked like she'd been sick. So they'd left her, with food in her mouth, and they hadn't been sick, it's probably the breakfast, the porridge. So obviously I feel that perhaps she is at times having problems in eating and perhaps drinking, because she's had a UTI not so long ago. Once again, perhaps that's also because of the lack of fluids at times.
How has she been with you? Have you tried feeding her or giving her anything to drink? 'Cause I haven't seen her eating or drinking, so it's hard for me to say what it's like. Has she struggled when she's been with you, or have she tried?
Not recently, no. The manager the other day said it depends who feeds her. Sometimes she does it well, but I've watched her take medicines and she can choke at times. But like I say, obviously the food, she didn't fully swallow the food on that particular time, Saturday last week. But once again, she has been there. She has seen a speech therapist before, because of
these concerns. Do you know how long ago that was?
Oh, that was a long time ago at the previous home.
Did they suggest doing anything differently at that time?
Well, yes. They find she has processed food, solids.
I see. Like blended sort of foods. Okay.
At first, I don't know what she's like now. Well, first of all, I tried to encourage them to use a beaker without the sip on it, because you could do that. In fact, at the beginning, a couple of months ago, I still could feed, but I could encourage her to hold the mug, and she could do it herself. The problem is, when you start pouring liquids down, it's very hard to get it in time with the person, isn't it?
Yeah.
But I'm not quite sure now, so I haven't fed her salt. Well, I've got restrictions on access now to see my mother. I'm not quite sure. Was that through Madame, or they went to a joint meeting because I've been taking photos?
It doesn't have anything to do with us, to be honest with you.
Sorry?
No, I think that's all come from the home.
Oh, all right. I knew apparently a doctor did attend one of the previous meetings, I believe. But of course now I can't actually record this, what I'm saying or doing at the same time.
Sure.
What I did record actually to try and get this staff is that she can hold a cup with support and feed herself at certain times. But once again, yes, I'm concerned once again at time. There was a couple of weeks ago a nurse who did put a note in the book for a doctor's call, but for some reason the manager, obviously perhaps the situation, I don't know whether we did address it here, that it can change, one day can be different from another, but the nurse actually did put the call down because during the whole day she had issues about the intake of solids or the processed food and also the drink.
Okay. I think it would certainly be appropriate to ask the speech language therapist to see her again, really, and then they can assess her and decide if there's anything that should be done differently in terms of her feeding and drinking and those things, and they can suggest, whatever they would think appropriate. Really.
No, this is a number of events, particularly reflecting on, once again, she did have that mild chest issue just recently.
Yeah.
Now, obviously, she, as you saw, she's in a chair now.
Yeah.
So you can rule out that she's not lying flat all the time.
No.
So it's nothing. So that's not why she got the chest issue. So there must be some other.
Well, these chest issues do. Obviously, chest infections do happen. So it's not strictly related to the eating, but I fully appreciate that the eating side of things needs to be reassessed and looked into for her.
Also, thanks very much for that. The other thing I was trying to get onto, because as she has severe dementia, is the use of sedatives. Is she still on us? Is it still actually put down? I noticed one of the nurses phoned up the centre a month or so ago asking whether they could use one because she was making a noise.
Okay.
They have taken it off because one of the things for the care homes, unfortunately, I exploited the chemical cosh. Because largely it was because the unit where she is, somebody else complained about her making a noise. But at times, this is rather awkward when she does get it. I don't believe she has been agitated recently, but I did go myself in the evening, and she was agitated, and all you needed, and that on that particular time, doesn't always work, a bit of company.
Absolutely, and I'd absolutely agree with that. I think in general, particularly when the elderly with dementia are in that situation, I absolutely agree that the most appropriate step is absolutely what you say, a bit of company, somebody to talk to, and hold a hand, and just, remind them where they are and all those kind of things.
I did take a video then myself, and she was more or less talking and smiling from being very agitated. So it does work at times. I can't say it always works, but still, there we go. So, well, thanks very much then, but I'm concerned about overall use. Because sedatives does not improve anybody's cognitive ability, and I'm not quite sure. And of course, they're only, your colleagues say, it's only a small dose, but, well, there we go. So,
Okay.
Thanks very much.
No problem, we'll get that speech language speech therapist thing sorted out for her. Okay, thanks for calling.
Thank you.
Bye then.
Bye.